Jenna, are we all good? Everybody in attendance tonight? We've invited you all here to discuss the ongoing threat of COVID-19 and address concerns from community members, agricultural and meatpacking workers, and community organizers about COVID-19, its variants, and the vaccine. My name is Christina Marshall. I am a law clerk at Legal Aid. And I'm a third-year law student at the University of Nebraska College of Law. The Agricultural Worker Rights Program at Legal Aid has partnered with the National Center for Farm Worker Health to sponsor community outreach events like this panel in order to reach rural communities, migrant workers, and farm laborers who may have been left out of the national conversation about COVID-19 and have been especially impacted by the pandemic. For more than 50 years, Legal Aid of Nebraska has been promoting equal justice for Nebraskans by offering free legal services, civil legal services, to those who couldn't otherwise afford them. Through its several programs, Legal Aid of Nebraska assists those that have been denied public benefits, those facing evictions or wage garnishment, and those in need of divorce or custody services, and many more. I could go on. The Agricultural Worker Rights Program helps agricultural workers in Nebraska assert their employment rights. Our focus is on ensuring agricultural workers are paid what they're owed under the law, ensuring that their working conditions are safe, and addressing harassment and discrimination in the workplace. And just so everyone knows, in case you're viewing this and would like to hear it in Spanish instead of in English, if you go down to the bottom of your screen, there's a little globe. It says interpretation. You just click on that and you select Spanish. And that brings me to introducing our translator this evening, Janelis Santa. Janelis is the outreach coordinator and paralegal for the Agricultural Worker Rights Program. She organizes events and coordinates with community partners, and she's our translator this evening because she is a total rock star. And then I'm going to introduce our panelists. First, we have Dr. Josue Gutierrez. Dr. Gutierrez takes great pride in being a leader in the medical field, not only for the Crete community that he serves with his clinic, Saline Medical Specialties, but for Lincoln and the entire state of Nebraska. Dr. Gutierrez has become one of the leading physicians in the handling of the COVID-19 pandemic, being one of the first to know of its impact in early 2020, as well as a crucial voice in safety precautions with COVID-19, in particular mask wearing, social distancing, and washing your hands. Dr. Gutierrez is a graduate from the University of Ozarks and graduated from medical school from the University of Arkansas in 2013. He went on to do his residency in Lincoln and fell in love with the area. After graduating residency, Dr. Gutierrez decided to stay in Lincoln and work for Saline Medical Specialties in Crete, wanting to help not only Lincoln, but the surrounding areas as well. Their lovely daughter, Rebecca, is Dr. Gutierrez's pride and joy and a big inspiration for him to help her and as many people in the community stay healthy so they all have a bright future. Dr. Gutierrez is very excited to share his expertise with you about the importance of the COVID-19 vaccine and to help return the people of Nebraska back to their lives to continue enjoying a good life. Our second panelist is Josie Rodriguez. Josie Rodriguez has worked for the state of Nebraska for over 25 years. She joined the Nebraska Department of Health and Human Services as the administrator of the Office of Health Disparities and Health Equity in September of 2011. Her responsibilities include administering and directing all aspects of the office, including program planning, strategic planning, policy development, and establishment of priorities to advance health equity in Nebraska. Her duties also include oversight of multifunctional programs that have a statewide impact, increasing awareness of the office in major health problems that affect racial and ethnic minorities, and building and enhancing collaborative relationships with stakeholders to achieve health equity for all Nebraskans. Josie also serves as co-chair of the Heartland Region 7 Health Equity Council, where she works with multi-sector stakeholders to combat health disparities and promote and advance health equity in Region 7. Josie holds a Bachelor's of Science in Human Service Administration and a Master of Science in Healthcare Administration from Bellevue University. She's worked for the state of Nebraska for over 20 years, working in various positions with diverse populations, including the Nebraska DHHS Office of Public Health, Medicaid, Children and Family Services, and the Office of the Nebraska Attorney General. So thank you both for joining us today.
Thank you for having us.
Absolutely. So I'm going to jump right in here. In many ways, the COVID-19 pandemic has been historic, impacting everything from the global economy to the overall health of individual communities. Despite the rapid global response to develop and market several vaccines for COVID-19, vaccination numbers have been underwhelming. In the US, as of July 14th, only 48% of Americans have been fully vaccinated. So to begin, I'd like to ask each of the panelists why they think people have exhibited apprehension in getting vaccinated, and hopefully we can address some of the unvaccinated people's concerns tonight.
Josie, want to go first? Then I'll go.
Sure. We have had many individuals that are hesitant to get the vaccine, and I think there's a variety of reasons for that. I'm pausing a little because of our interpreter. So, I think that one of those is lack of information. I think sometimes people do not have enough information to make an informed decision. And that is one of the reasons that we're here today, right? Is to provide information to individuals so that they can make a decision on if they want to get the vaccine or not. Another reason is that there are many people that are hearing a lot of things on social media. It could be Facebook, it could be TikTok, it could be the other social media avenues that are in many other countries as well. I know that there's different apps for, that are used in Mexico and in other places. What's Up is one of those. And, a lot of things that people are seeing are just not accurate. And that information gets spread very easily from one individual to another. For example, my husband is from Mexico, and his family in Mexico is hesitant still to get the vaccine because, they heard that somebody died because they got the vaccine. They didn't have the whole story. And so those rumors are just out there and people are believing in them and not having the totality of the information that they need to, like I said, be able to make an informed decision. So I think that having us here today to answer this question is very good, and hopefully people will be asking more questions as we continue the discussion today. I'll let Dr. Gutierrez give his feedback as well.
You are extremely right. I think misinformation is one of the things that we need to really fight against. I think that having experts and really medical personnel give their opinion and truly facts, scientific facts about the disease, about the vaccines is extremely important. I think at times we go to Dr. Google and we kind of look everything up and we don't really look at the sources that they're really citing. And I think that we need some more reliable sources that we need to be listening to. The other thing is, I think it has become a little bit of a political issue. And I think that healthcare and politics at times should not mix. I think we should be looking at healthcare as science-based, what is good for society as a whole, and not make it a political issue. Because when a political issue is made, I guess. We have different sides, and they're saying, "Oh, I don't want to get the vaccine because then I'm going to be looked at as that political side." I think this should not be a political issue anymore. This should be an issue of taking care of your fellow man and also just keeping everyone safe. So those are two of the big things we need to kind of be thinking about.
Yeah, I absolutely agree. That the number one goal here should be about protecting your fellow man, keeping your friends and family safe. So I guess my first question is, how effective is the COVID-19 vaccine? And there's different brands. We've heard a lot about the different brands. And I was wondering if there is a difference in the effectiveness of those brands. And I guess I'm going to direct this question to you, Dr. Gutierrez.
Of course. So yes, there are different types of vaccines. Right now in the US, we have 3 vaccines that have been given authorization, emergency authorization. These are the Pfizer, Moderna, which are mRNA vaccines. They require around 2 shots, 3 to 4 weeks apart. We also have the Johnson & Johnson vaccine, which is a vector vaccine, and that requires only 1 shot. Now, before I continue, I need to really say this. Even though the vaccines were given emergency authorization, they are safe. I think that one of the things we are always very scared about is like, oh, why did they come out so quickly? Or they really had to skip some steps to actually get that vaccine out in production. That didn't happen. The FDA actually had to go through the same rigorous process that other vaccines do take. What was different is the whole world was actually trying to get this vaccine in production. So there's a lot more resources, there's a lot more candidates to actually go into these studies, while other vaccines in other times, you would have to pull teeth to get people into the studies. Maybe the resources were not there. So you need to first understand that the resources that were there is what made that, rapidity of this vaccines to come out so quickly. So we need to look into that. It's safe. Now, if we look at the efficacy, we have to kind of balance it in 2 different types of efficacies, to the old variants and the new variants. If we look at the overall efficacy of the Pfizer vaccine, it's around 95% in preventing truly severe cases. The Moderna is around 95 as well. Johnson & Johnson, 65 to 72%. Now, we're still gathering a lot of data for the efficacy of the new variants. We have so many of these. And by new variants, we mean mutations to this virus, because as a virus spreads from person to person, it has the capacity to truly change something in its genetics. So when that happens, we get a little bit of a different virus, and that might make it more virulent, more easily spread. That might make it, stronger. So what we need to do right now is truly stop the spread, because the more it spreads, the more the capacity of variants to be created. And that's what we are truly scared of. Right now, we have, the Pfizer vaccine, possibly around 79 to 92% effectiveness against the Delta variant. And the Delta variant came out of India. And this variant is extremely virulent. We have around, I think it's around 200% more transmissible, and the viral shedding is 1,000% more than the usual variant. So if you actually look at those numbers, we see that the Delta variant is a formidable opponent right now, because it's just spreads like wildfire. So we need to be looking into that as well. Now, the J&J and the Moderna vaccine, we're still kind of looking at the effectiveness. We do know that there's some protection against Delta variant with these 2 vaccines. There might be less neutralizing antibodies, but overall, all the 3 vaccines that are authorized are protecting us against these new variants.
That is great news to hear. I know that's something that I personally was concerned about. So we've talked about the efficacy of the vaccine. We've talked about the safety. Dr. Gutierrez, are there any risks associated with the vaccine? Any credible risks?
Right now, we have the regular common side effects. I tell a lot of my patients that if you do get this vaccine, many times you'll get similar symptoms like the flu vaccine. You have some soreness in the arm, pain, redness, swelling to that injection site. Sometimes you get a fever, and that's just a natural reaction to a vaccine. There has been times where in the media you have heard about blood clots, more in the Johnson & Johnson vaccine, most recently Guillain-Barré syndrome. And all those are truly studied by the FDA because they have a huge repository of information. And every time there's an adverse outcome, you have to kind of tell the FDA about it. And with the blood clots, the FDA looked at everything and said, okay, it's still okay. We can still give this vaccine safely. So even though there's been some blood clots and possibly GBS type symptoms, they were still vaccinating people with those vaccines because they are still effective and the benefits outweigh the risk.
And I'm assuming the number of those adverse reactions has been great.
It's a truly minuscule. I think that if you look at the blood clots, if you truly get COVID, you have a higher percentage of getting a blood clot than from the vaccine. So you're risking yourself more if you get COVID of getting a blood clot than actually getting it from the vaccine itself.
So I guess on that note, with schools starting up again in the fall and many schools going back to full-time in-person classes, concerns about children being exposed or bringing bringing COVID home to their families. Those are prevalent concerns. Is it safe for children to get the vaccine? Are there different risks associated with vaccinating children?
So right now, we have the Delta variant that is truly virulent. It's really easily spread, and it spreads the same way as the previous virus. It's a droplet, meaning coughing, talking to someone, close distances. So if you do go to school, there is an increased risk of passing this virus. So yes, there is a risk whenever we do go into in-person classes. There are some areas in the world that are once again doing mask mandates, or once again going back to those original restrictions because of the virulence of this variant. So yes, there is a risk. Right now, the American Academy of Pediatrics recently, I think it was yesterday, came out saying, we need to mask up again, guys, and it doesn't matter. Anyone that's 2 years and above, go ahead and wear your mask once again because of the virulence of this new variant. So I think that, yes, there is a risk. Looking at the vaccine components right now, I think we have the Pfizer vaccine that is in ongoing trials. Hopefully by November, January, we have a vaccine that could potentially give us maybe from 6 months and above for vaccinating children 6 months and above. Right now, we have 12 and above, but that's about it. Now, looking at the risks, we have, there's always risk inherent to the pediatric population, but we're not seeing that many. So I think we're still looking at the safety of the vaccine compared to adults.
Thank you. This next question is for you, Josie. Where can one go to get the vaccine? Does it cost anything? What if someone doesn't have insurance? Those kinds of logistical questions.
Yeah, right now it's different. We're in a different stage than we were, probably 8 months ago to, when we first got the vaccine. I'm pausing a little bit for the interpreter. So I want to let people know that you can register. We do have a portal where people can register to get signed up to get the vaccine. And what will happen is that you'll get an email or phone call from health department where you can go and actually get the vaccine. And that website is vaccinate.ne.gov. We also have a COVID information line because, we know that people may not have access to a computer. They might not know how to use a computer. I mean, I know if it was, I registered my mom, because, she's a little older and not as savvy. And so you may need help. So if you don't have anybody that can assist you, you can call this COVID information line. And I'm going to give that phone number. It's 531-249-1873. And we also have a toll-free number, which is 833-998-2275. And individuals can call that line, and it is available in Spanish as well. They just need to hit, I can't remember if the button is 2, but it'll tell you, click this, select this number for Spanish. And you can find out where you need to go to, what health department is in your area. So they can reach out to the health departments to get a vaccine. You can also go to a federally qualified health center. You can also go to your doctor. So if you don't have a doctor, you can go to a federally qualified health center. We have some throughout the state. Unfortunately, there's a big gap between like Grand Island and Scotts Bluff, but the health departments can definitely give those shots as well. The federal government also provided quite a bit of money for the vaccine. So the vaccines are free. Nobody should be charged. Sometimes a pharmacy may charge to put it in your arm, but if you can't afford it, then you don't have to pay. But you can go to pharmacies as well, IV, Walgreens, CVS. I know other local pharmacies are also participating in the program as well. So there's a lot of different options to get the vaccine, and no, you do not have to pay for the vaccine. As I said, it is free, and the government and Nebraska wants to make sure that there's enough vaccine for everyone.
Excellent, thank you. I feel like we've already touched on this question a little bit, but I think it sort of bears repeating. What are the risks if someone chooses not to be vaccinated? We've heard a lot about it just feels like the flu. How is it different from a flu, I guess is my question.
I think we need to look at the potential repercussions. If you do get severe COVID and you have multiple comorbid conditions, you have diabetes, hypertension, COPD, multiple conditions that can put you at risk, there is a good chance you'll be hospitalized, and that could lead to a lot of complications to death. So even though it feels like the flu for someone that's extremely healthy, that other person that's not as healthy might not get flu-like symptoms. So you have to protect everyone and your nucleus, as well as your work area, things like that, to truly get to more of a herd immunity type thing. We've heard a lot about that. It's not the only way to do it, but we need to put as many vaccines in arms as we can. So that's one way to actually get it, or one reason to get it, to protect everyone else. But you also are protecting yourself. I think that there's a lot of repercussions with COVID. We're still trying to figure out what the long-term consequences of COVID are. We have seen some cardiomyopathy, which is inflammation of the heart. We have seen some long-term sequelae of COVID, and we're still studying this virus. So we're still not sure what can truly happen in the future whenever you get that infection. So yes, it might look or feel like the flu, but we're not sure what happens after. So it's a safety issue.
And I would add here too that, the risks are that you could, like Dr. Gutierrez said, you could be putting your family at risk as well. I mean, a lot of Latinos and other minority populations live with extended family. And so you could be putting not only your children and your immediate family at risk, but, your parents, your grandparents, if you live with them as well. So, it's really something to think about. It's not only you, but it's your entire family.
This question is for both of you, I guess, from the sort of government side of things and as a healthcare provider. When people are getting vaccinated, what kinds of information will people be asked to provide? And how can we ease concerns about accessing public health benefits like the vaccine for people who may be a little wary of giving their name to a government entity, particularly people who worry about having to list their immigration status, for instance?
Yeah, I'll go ahead and start with this question, the answer to this question. We know immigration questions are asked at all. So people are not wanting any information on your immigration status. The most important thing is that we want to provide vaccinations for everyone that wants a vaccine. You may be asked, you will be asked for your name and your date of birth and phone number. And why we need that information is to be able to get a hold of you. Dr. Gutierrez just a minute ago said that some people might have an adverse reaction to the vaccine. Once you get the vaccine at the location, they do have you stay for a few minutes to make sure that nothing happens immediately, but they do want to be able to get a hold of you if something does happen. Now, yes, hopefully you won't have to go into the hospital or something, but it's important to have that information. That's how we are able to contact people about any adverse reaction. So the other thing I want to share is that the state of Nebraska will not share this information with others. It's our responsibility to keep information confidential. And so when numbers are reported like to the federal government on how many vaccines, those are numbers. We do not put names associated with those vaccinations. So there are laws that require us to keep information confidential. And so, like I said, we want to make sure that people are able to get the vaccine and are not fearful of that. So, like I said, we are not sharing that information with anyone. We do not ask for immigration status. They may ask you for an ID, but you do not have to provide it. If you don't have an ID, you don't have to provide it. I know that when my husband went, he didn't have it. He didn't provide his ID. So do not be afraid to say, I don't have my ID, so I can't provide it to you, and they will still give you the shot.
I want to rehash one thing is, even if your legal status here is not, legal, you're still part of the community. I think we're all in this together. We cannot just vaccinate one specific population and then leave another one without vaccination, because we're all of us are part of the community. And I think that that's something you need to keep in mind, that everyone needs this vaccine because you are living in that community. You are part of that community.
I absolutely agree. The vaccine doesn't recognize, or the COVID-19 doesn't recognize borders. So we do have a question in the chat, and I just want to remind everyone that you can submit questions. We have a Q&A function. You can submit them in the chat. For those joining us from Facebook, we have people who are moderating the Facebook chats, so your questions will be answered as well. And so our question is from WMA Hannah, and they're asking, many were asymptomatic when COVID first started to spread. Is that still the case with the Delta variant, or does it hit a person harder so symptoms are more likely to show up?
At this time, you can still have some of that non-symptomatic spread. So yes, the Delta variant can cause no symptoms still. What we're seeing is it's 1,000% higher viral load. What that means is, if you're going to present symptoms, you will be, we had some instances in the past that we had to wait a couple of days before saying, okay, yes, this is COVID because of the viral load. Now we're not seeing that. Now we can actually look at that viral load and say, yep, it's COVID, because the test will actually come out positive more frequently, or actually earlier in the disease process. So that's what we're seeing right now. We're also looking at a younger population getting this, and of course, unvaccinated population is getting more of this variant. So unvaccinated younger population are getting this.
We have another question from Facebook. This person is asking, what is the death rate at now? And I'm not sure if they're asking like how often COVID kills people, or if they're asking like what the death toll is. So I guess if you just want to cover both, if either of you know.
Yeah, as of today on, I believe it's on our webpage for Department of Health and Human Services, cumulative is so total deaths for Nebraska have been 2,285 deaths. So, you know, unfortunately, many people have been impacted by COVID. You know, some people have, you know, had family members that have passed away. And again, I go back to that's why we're on this call. It is a highly contagious disease that can impact people differently. Some, you know, may have mild symptoms like Dr. Gutierrez said, some have to be in the hospital, be on a ventilator, and some unfortunately do die of the virus. So that's why it's important to get as much information as you can about it, get as much information as you can about the vaccine, and really make that informed decision.
We had a sort of comment come in from Facebook. And I'm going to sort of phrase it as a question. This person said that when they got their vaccine, they went to Walmart and they were told to show ID. What can a person do in that situation? Is there something that they need to invoke? Do they need to like let them know like that's not how the law works? Or are private pharmacies like that sort of allowed to ask for ID?
You know, the pharmacies do sometimes use insurance. So sometimes they will use that identification to bill insurance. But even when I go, usually there's a lot of identity theft sometimes happening as well. And I know that I've been recently asked to show my identification too, to make sure I am that person. So that could be one of the reasons. If it's a COVID-19 though, the federal government is also stating that identification cannot be required because they're giving that vaccine. So I would definitely agree with what you said to say, hey, the state of Nebraska said that you are not allowed to ask for ID. And I don't have my ID with me, you could say. You don't have to say, I don't have my ID. And we are asking individuals to let us know if that is happening, so that then we can follow up with those organizations that are doing that, or those places that are doing that.
Thank you. I think that that's going to be really helpful information for people, so they feel a little empowered when they go to get their vaccine. So I guess my next question, again, this one's probably going to be for both of you based on your experience. According to a study from Purdue University, nearly 600,000 agricultural workers in the US have contracted COVID-19. In addition, the sort of protections we get from like the CARES Act or the Rescue Act, the like paid time off, or just 2 weeks off in general without losing your job, often don't apply to agricultural workers and other kinds of workers like independent contractors and the like. What are the continued risks to agricultural workers, and what can they and their families do in addition to the vaccine to protect themselves and their families?
I think there are a lot of things that are a greater risk for agricultural workers. Sometimes they do live in multi-generational homes in very close quarters. I think that proximity can truly help the spread of that virus. So they have to, you know, social distancing, hand washing, the usual health benefits of getting those guidelines there. But you also have, sometimes they travel from place to place. And that traveling can truly, you know, you go from an area where maybe vaccination rates are lower than other areas, and you can spread some of that disease that way. So as long as they are truly looking at their symptoms, not scared to actually tell someone about those symptoms. They have to be conscious that, you know, their lives are at risk. Yes, there's a lot of fear at times from their legal status, or just what will people think of me if I do have this virus. That has to go out the window. That has to truly go out the window and say, we need to take care of this, and it's for me and my family.
You know, I will add, as I continue to mention here today, that just making sure that you wear a mask, you know, you wash your hands, you physical distance, especially as Dr. Gutierrez said, if you are someone that has pre-existing conditions or are at higher risk for contracting the virus, make sure that you're keeping yourself safe. You know, I know that during maybe June, when we saw a lot of cases go down, people maybe weren't as cautious in doing all those things that they were before. Now with this new variant, especially if you're an agricultural worker and having to be around people that you might not know if they're vaccinated or not, you want to keep yourself safe. So wear that mask, make sure you're following all those protocols, like I said, of hand washing and keeping your kids safe. You know, taking the risk of getting kids sick is not good. So I would, if you don't know if somebody's been vaccinated or not, you know, don't let them into your house around your children and around family that hasn't been vaccinated, because as he said, it can spread much quicker and continues to do that.
Yeah, it was definitely concerning to read about not just the number of agricultural workers who've been affected, but the increased risk that sort of derives from working around things like pesticides. So glad that we're doing this like for this specific community as well. And this question's more for Josie. We know that, oh, we've already talked about the variants, never mind. So I'm actually out of questions. Is there anything that I haven't touched on that the two of you would sort of like to go over with us right now?
I think that right now a lot of people are, of course, burnt out from this pandemic. We've been indoors, we've been following social distancing guidelines, masking up. Yes, a mask is not very comfortable, even though we can jazzercise it or whatever it is you want to do for it, it's still not comfortable. But the numbers were going down, but now they're coming back up. We have a clear case in Arkansas. Arkansas right now is being hit quite hard. Their vaccination rate, I think, was in the 38% for Arkansas. So we are seeing a lot of cases from the Delta variant in Arkansas really start to thrive. We don't want that to spread to other locations. So I think we need to be conscious, be careful. Many cities have taken away their mask mandates. Just because that happens doesn't mean we can't wear masks. So I think that's one of those things that just continue wearing the mask, social distancing. And yes, it gets tiring, but we're still not there. We still need to get to that finish line. We still haven't crossed it yet.
You know, and I would add that, you know, just stay safe. A lot of the individuals that are hospitalized and have been individuals, the majority have been individuals that are not vaccinated. And so that's why it's so important to make sure you get education and determine if you want to get the vaccine. As Dr. Gutierrez said, it's very safe. So keep that in mind. And I think it's also important to just remember that you, by getting the vaccine, as we mentioned earlier, you're keeping your family safe and your children as well.
We had another question from Facebook. Let me read that for you. Test Nebraska is set to end July 31st. What is the role of testing going forward? And will people still have access to free testing?
Yes, people will still have access to free testing. Testing Nebraska is phasing out, and that's because a lot of state resources are being used to do the testing, and there's not as many people getting the tests anymore. So we're phasing that out to local organizations to do, like health departments or your regular medical provider, federally qualified health centers. There's a lot of just testing that you can find in pharmacies as well. There's the Buy Next card. So there's different options for testing now, and that was the reason. So support will still be provided to those organizations, and the state is collaborating with those organizations to continue to make sure that there are testing options. So I know a lot of local providers will have options for testing as well, and there will be free options. So if people find that they're being charged for testing, contact your health department. And you can use, again, if you don't know who your health department is, you can use that hotline, and they will let you know who the health department is, and the health department can help you get tested for free if you need it.
We had a follow-up question for that as well. How is testing information being shared with the community? So like the rates of COVID in our community, how is that being sort of publicized?
Yes, the state of Nebraska used to update numbers on a daily basis, and they moved away from doing that because we were doing that because we were in a state of emergency. The governor declared the state of emergency. And as I mentioned earlier, the state is required to keep personal information safe, especially when it's regarding a virus or some condition. We were able to share as much information as we had because of that emergency declaration. Because it's over, now we're having to, there is a law that tells us what we have to do. And so now we're having to go back and follow that law. The state is, though, on a weekly basis. So today even you can go on the DHHS website, and right in the middle, there's a COVID information link that you can click, and you can see some of that information. So you could see positive cases, vaccination rate, and then I believe testing is on there as well. So the state is still providing some information, not to the extent it was before, but they are still providing that information.
We have another sort of follow-up question to that. What is the best way for agricultural and workers' children to receive a COVID test? I know that for testing at pharmacies like CVS, they have to be at least 10. What is the best advice for parents with young children to be tested?
Dr. Gutierrez,
I think that just your local primary care clinician or primary care physician has testing available. I think no one will deny anyone a test. And it's also good at times to just go to that primary care clinician because they can tease out, is this truly COVID or is this some other virus? As the masking has gone away, we are now seeing an uptick of other respiratory diseases as well. We kind of diagnosed some RSV cases here recently, and we didn't see much flu at all this year. And I think that was because of masking. But now that some of the masking requirements have gone away, we have other respiratory diseases as well. So it would be a good idea to just go to that local doctor and get tested there.
And I will mention again, if individuals do not have a local provider, you can also contact your federally qualified health centers. They are doing a lot of testing, a lot of vaccinations as well.
Okay, we have a question here in the chat. It says, when vaccines first became available, the governor said that people who were status would not be allowed to receive vaccines through the health department and state facilities. Has a workaround for that been shared with immigrant communities?
Will you repeat that question again for me? I apologize.
Absolutely. They're asking, when vaccines first became available, the governor said that people who were without status would not be allowed to receive vaccines through health departments and state facilities. Has a workaround for that been shared with immigrant communities?
You know, I am pretty sure that in a following press conference after that, there was information shared with everyone that the vaccine is for everyone in the state of Nebraska. And I think there's some frequently asked questions on our website too that may address that question as well. So as I mentioned, that's on the DHHS website. On the main one, you can just click COVID information, I believe is what it says. And there's a lot of FQHCs that are on there. But as I mentioned earlier, you know, Nebraska is committed to ensuring that everyone has access to the vaccine and who needs that. So we are not asking those, health departments or others are not asking that question. And I would ask that, you know, community-based organizations or others that are assisting individuals with, you know, in knowing that information, they assist us in letting them know.
I have another couple of questions here. First is one from Facebook. I just read today that Lincoln received a $3.5 million grant for COVID-19 outreach to minorities. Are there any plans to target migrant workers with this grant?
Yeah, I believe that $3.5 million grant that the city of Lincoln received was health literacy related, and it is to assist with COVID mitigation. So I believe that they are working with many cultural centers across the city to be able to provide vaccines and probably testing as well and other needs to COVID. So yes, I believe that they're working with community-based organizations to do that. I will also let organizations and individuals know that the state of Nebraska also received some funding from the Center for Disease Control. And we are also looking at opportunities to provide testing and vaccination out in the community, and especially in rural Nebraska. We're really trying to target rural Nebraska, and I know that's where many migrant workers work. So I would contact your health department because they are definitely aware of the funding and they're aware of organizations that are assisting with that. But we are going to be providing some information about the funding that's available here soon. And some of that funding also went to federally qualified health centers. As I mentioned earlier, they are assisting and doing a lot of that vaccination and testing as well.
That's great news.
And I do believe that they are also working with community-based organizations to try to get out to where people often go. I know that a lot of individuals may feel a lot more comfortable getting tested at their local community-based organization. And so we're trying to really enhance those collaborations between FQHCs, health departments, and community-based organizations so that they can go out to those organizations and assist in getting people vaccinated where they're at. You know, if there is a place, even if it's out where migrant workers are working, where they want to get vaccinated, and there's many, we can sure work with our partners to identify opportunities to be able to do that.
We've done a few of those here at Legal Aid, where we've worked with other community partners to travel out to work sites. I have another Facebook question. Do you know if health centers are allowing for walk-up testing of children? I don't know if they are referring to federally qualified health centers or just health centers in general. I guess they're asking if you need to make an appointment.
Now, I am not sure if they are health departments or federally qualified health centers. I'm not sure if they are allowing walk-ups. I would definitely call the COVID information hotline, or if you don't know your health department's, what health department is in your area, or if you do, go ahead and call your local health department and they can answer that question.
Sorry, I'm just looking around, making sure we don't have any more questions waiting. I guess I sort of had a question personally for people who are vaccinated. I know Dr. Gutierrez, he said earlier that there are places that are going back to mask wearing, and that some physicians are recommending we go back to mask wearing. For people who are vaccinated, do you think that that's still a good idea? As well as, you know, social distancing, maybe staying out of large gatherings?
Yes, the answer is yes. I think that even though you are vaccinated, you can still get the variant, you can still get this disease. You might not get the severe case of the disease, but you can still spread it and you can still get it. So I think masking is just another barrier of protection for everyone around you and yourself as well. So I think that the answer is yes. I think social distancing, hand washing, wearing a mask, all those things continue to be very important in this battle. So even though we have many different organizations, CDC, WHO, AAP, American Academy of Pediatricians, if AAP says, you know, kids 2 and above should be masking, I think we should follow some of those recommendations as well.
You know, one other thought is that, you know, we are still in summer, but fall is coming quickly. And, you know, we have seen much less cases of the flu, and it's really helped. You know, we've noticed that wearing that mask really helps from, you know, spreading a lot of things, especially the flu. So I would recommend it just for that as well.
I know I
In addition to
sick all last year. So I think we're going to start wrapping up here unless anyone has any final thoughts that they'd like to share with us. I'd like to thank both of you again for joining us tonight. I feel like this has been very informative. I know I learned some things, and I feel like I've been keeping up with the news about COVID pretty well. So thank you again. And I'd like to thank Janelis as well for translating for us. That was a huge job, and I'm sure we were difficult to keep up with at times. So thank you very much. So yeah, thank you again. Is there any resources that we should direct people to as they're heading out of here? I've gotten the hotline and the website for COVID, for vaccine registration. Are there any other places that people should be going to look once they leave this webinar?
Yes, I would also note that we do have information regarding COVID and vaccines on our DHHS website in a variety of different languages. So not just Spanish, but other languages. The CDC, of course, has a lot of information, but I would definitely start on our website and take a look at some of the information that's there. It's not all written. There's some other things there, some flyers and things that if you're from an organization, you can put up. And I would, you know, just say if there's any other questions that come in, do not hesitate to reach out to us. And then, of course, the hotline, as you said, and then reach out to health departments with any questions too. They're the local feet on the ground there that can assist with any questions also.
I think it's been a long road. I think there's some more months to come. who knows, depending on the variants, but I think we can beat this. I think we just need to continue, finish strong, always think of everyone, not only yourself. It doesn't matter your political ideology, it doesn't matter your race, doesn't matter your religion, nothing of that matters. This is just about beating this thing and finishing up strong. So just, keep on chugging, keep on trucking. So continue with all that.
And I wanted to let everyone know before we get out of here, we will be sort of compiling the Q&A that was asked here tonight, get those answers typed up in a nice little PDF along with the recording of this event. And we will be sending that out to everyone who registered to attend tonight. So keep your eye on your inbox in case there was anyone here who wasn't able to be here tonight that you think could benefit from this information. So again, thank you to everyone for coming. I hope you guys have a great evening.
Thank you.
Thank you.
Thank you, Janelis.